Hello everyone. Today we shall discuss regarding first aid in emergencies. Now, emergency scenarios can arrive at any given point of time. So when emergency scenarios are arising at any given point of time, we need to be prepared to provide the much needed first aid to the casualty. So when discussing the first aid in the emergency situations, the various types of the emergency situations that can happen are such as the external bleeding, the internal bleeding, collectively known as the hemorrhages, such as shock, asphyxia, drowning. These are to name a few. And when these emergency situations are arising, it has to be made very sure that the adequate first aid is being given. Now, severe bleeding and a life-threatening condition known as shock require immediate emergency medical care. Now, bleeding, severe bleeding, it can be an external bleeding or an internal bleeding, and these bleedings require, along with another condition known as shock, immediate medical conditions. Now, when immediate medical assistance is being not provided, there are chances that the casualty might lose their lives. The circulatory system or cardiovascular system is responsible for the distribution of blood to all parts of the body. Now, when we are discussing regarding the bleeding or the hemorrhages, it is essential for us to get a basic idea regarding the cardiovascular or the circulatory system. Now, there are three main components of this system: the heart, the blood vessels, and the blood flow in these vessels. So, the heart, the blood vessels, and the blood flow in these vessels or the blood components are playing a major role in the circulatory system. That is the blood. It consists of the white blood cells, the platelets, the red blood cells, the heart obviously because it is beating the entire and regulating the entire functioning of the body, and the blood vessels. Now the blood vessels include of the artery, the veins, the capillaries. So these all collectively work together to provide a smooth functioning of the circulatory system. Now, if by any of the chances, due to any of the reasons, there is a disruption and causes or any of the external trauma leading to an external bleeding or internal bleeding, the first aid assistance need to be given on an immediate basis. Artery. Arteries carry oxygen-rich blood away from the heart. So when we are discussing artery, so what is the function of the artery? As you can see in the picture, depicted in the red, that is rich in the oxygen. So the artery carry the blood away from the heart. So when the heart pumps the blood, arteries carry these blood to the different parts of the body. Capillary. Oxygen-rich blood is emptied from the arteries into microscopically small capillaries that supply every cell of the body. As you can see in the picture, the microscopically regions where the arteries empties their blood is called as capillaries. Vein, which carries the deoxygenated blood back to the heart. Veins have one-way valves that prevent the blood from flowing in the wrong direction, as depicted in the blue color, as it consists of a deoxygenated blood. And these veins have valves which prevent the blood flowing in the wrong direction, and these veins carry these deoxygenated blood towards the heart. So this is a basic idea regarding the circulatory system and what is made up of the circulatory system. It includes of the heart, the blood, and the blood vessels. The blood vessels, namely the artery, the capillaries, and the vein. Now arteries are responsible for carrying of the oxygenated blood. The capillaries are having a connection between the arteries and emptying of the arteries takes place over here, and veins are responsible for carrying of the deoxygenated blood towards the heart. Now, what are the functions of the blood? As we have been discussing, the blood consists of the white blood cells, the platelets, the red blood cells. So what exactly are the functions of the blood? Regulations of hormones, water, salt, enzymes, and chemicals. So for the regulation of the hormones, for the regulation of the enzymes, the regulation of the salts and the water content of the body, the blood plays a very essential role. Protection, as it consists of the white blood cells, it is providing and playing a role in the protection. excretion, nutrition roles are also being played, and transportation of the gases is a very important function of the blood. Bleeding or hemorrhage. Now it's an emergency. The first aid emergencies, when we are discussing, bleeding has to be said as a very important emergency scenario that arises, as it can happen at any given point of the time. It can be of any of the types. So let us see what exactly first aid treatment has to be given in case of the bleeding. Severe bleeding or hemorrhage is the major cause of shock hypoperfusion. So if there is an excessive bleeding or hemorrhage occurring, so it is one of the major causes when the patient undergoes a shock. The cells and the tissues that are the most sensitive to inadequate perfusion are those of the brain, the spinal cord and the kidneys. Now when there is a scenario occurring in which there is an excessive blood loss from the body happening and the patient is going into a state of shock. So in these scenarios, the body's vital organs such as the brain, the kidneys and all these organs start responding towards this loss of the blood and start showing the dysfunctioning, and hence the patient enters into a multiple organ failure state. So bleeding or hemorrhage can be classified in two. Now when we are discussing bleeding or the hemorrhage, it can be of two types. It can be either an external or an internal hemorrhages or the bleeding. The name itself suggests the meaning. External indicating externally, outwardly, outside of the body something is happening, on the outer part of the body. Internally, within the body, a bleeding is being happening. Let us see. External bleeding. Whenever bleeding is anticipated or discovered, the use of a body substance isolation precautions is essential to avoid exposure of the skin and mucous membranes. Now, whenever a bleeding is being seen, an external site over the skin region, any bleeding is being observed. So in that, body substance isolation has to be done so as to protect, for the purpose of the protection. Blood and open wounds pose a high risk of infection to the first aider or emergency care provider. See, when the first aid is going to be provided, the person who is going to be providing the first aid is also at a risk for any kind of the infection, because if in case of an external bleeding, the wounds are going to be open and there is going to be a direct contact from the patient's body towards the person who is providing care to their body. So an isolation or the protection equipments have to be used. The body substance isolation precautions include protective gloves, mask, protective eyewear and gowns. So the emergency medical supplier assistants has to wear, or the first aid assistants has to wear protective gown, gloves, mask and eyewear so as to protect their own self while providing care to the casualty. External bleeding is classified into three types based on the injury and the loss of the blood. Now when we are discussing external bleeding, initially the bleedings are of two types, external and internal. Now again within the external bleeding, it is of again three types, namely arterial bleeding, capillary bleeding and venous bleeding. Now the name itself suggests what kind of bleedings are these gonna be. If the bleeding is occurring from the arteries, it is called as the arterial bleeding. If the bleeding is occurring from the capillaries, it is called as the capillary bleeding. And if the bleeding is occurring from the venous regions, so it is called as, or the veins, so it is called as a venous bleeding. Now types of the external bleeding. As you can see in the picture, a small cut is there on the fingertip. So if it in case of the capillary bleeding, slow and oozing, easily controlled, stops spontaneously. Whenever there is a capillary bleeding, the characteristics of capillary bleeding are going to be the blood that comes out is going to come out slowly and is going to be oozing. And it's going to be very easy to control it and it's going to stop on its own spontaneously. Now, in case of a venous bleeding, steady flow, easier to control, low pressure system. The bleeding is going to be there, but the flow of the bleeding is going to be steady, but also a larger in amount as compared to the capillary bleeding, and it is going to be a low pressure system, so the venous bleeding will also be easier to be controlled. In case of the arterial bleeding, rapid and profuse, as you can see in the picture, the amount of the splashes and the blood splashing over everywhere region is being seen. Spotting with heartbeat, most difficult to control. If the arteries are being cut, the blood is being spurt out of the regions and it is very, very difficult to control. Rapid and profuse. The arterial bleeding is very rapid and profuse. It is very difficult as compared to the venous and the capillary bleeding to control the arterial bleeding. So these are the three main types of the external bleeding. Severity of external bleeding. The severity of bleeding is dependent on the amount of blood lost in relation in physical size of the client. Now, whenever the severity of bleeding is being discussed, now at that time the size of the client is also being discussed. So as compared to the size of the client, the amount of the blood that has been lost depicts how severely the bleeding has occurred. In an adult, sudden loss of 1 liter, that is 1000 cc of blood, is considered serious. In a child, 500 cc blood loss is serious. In 1-year infant, 300 cc and even 150 cc loss is considered serious. Now, as you can see, if it's an adult, 1 liter or 1000 cc is considered to be serious. If it's a child, then 500 cc is to be considered serious. And in an infant, 300 or even 150 cc is considered to be serious. So, the size of the individual depends on the severity, or to say how serious the blood loss was. If the patient begins to exhibit signs and symptoms of shock, hypoperfusion, the bleeding is automatically considered serious. Now, if because of the excessive bleeding, there is a chances that the patient is entering a state of shock or a hypoperfusion, so it is automatically considered as serious. Now, what are the signs of shock? It is being said previously that because of the excessive bleeding, the patient may enter into a state of shock. So how to know if the patient is entering into a state of shock? So it can be seen as altered mental status. Brain is not receiving oxygen, pale, cool, clammy skin, diversions blood from the non-vital areas in the vital organs. So now, since because of the excessive blood loss, the body is now diverting the blood flow from the entire region towards the vital organs, so as to keep the functioning of the vital organs going on. And because of that, the skin is going to be clammy and cold. Not only that, because of the reduced level of the oxygen within the body, because of the loss of excessive amount of oxygen, there is going to be altered mental status, nausea and vomiting and vital signs changes. So along with this, the nausea, vomiting and vital signs changes can also be seen. As you can see in the picture, altered state of consciousness, restlessness or irritability, pale or bluish, cool moist skin, excessive thirst, rapid and weak pulse, rapid breathing, nausea or vomiting, and these are the signs of shock. Now, if patient is exhibiting these signs along with excessive bleeding, they require emergency medical assistance. Patient or client care for external bleeding. Now, if any of the external bleeding has happened due to any of the causes, what is to be done? Emergency care steps. Client assessment and care always begins with the CABs. That is, you got to check for the airway, the breathing and the circulations. Assess the circulation by taking a radial pulse, assessing skin color, temperature and condition, and controlling external bleeding. So what is to be done? The first thing that is to be done is assessment of the patient. When assessment of the patient is being done, focus on the airway, the breathing and the circulation. The vitals are being checked. The skin of the patient is being assessed. And not only that, controlling the external bleeding is also focused upon. Now, when the focus is upon controlling the external bleeding, there are various methods, and by any of these methods, the bleeding can be controlled. So, major methods of controlling external bleeding are: number 1, direct pressure. When direct pressure over the bleeding site is being applied, this is one of the ways how bleeding can be controlled. Second being elevation of the pressure points. Now, when those extremities or those regions from where the bleeding is happening, so elevation of those regions so as to stop the bleeding. Splinting, in case if it is a musculoskeletal injury and because of that bleeding is happening, so in this scenarios, splinting helps in reducing of the bleeding. Cold application. Over the multiple scenarios, cold application has been seen very effective in reducing the or minimizing the bleeding. Applying tourniquet is the last resort. Now, if direct pressure or splinting or elevation of the pressure points or cold application, neither of these solutions work, then and then only applying of the tourniquet is said to be the last resort for controlling of the external bleeding. Apply direct pressure to the wound with a gauze pad. Do not waste time looking dressing. Instead, apply direct pressure to the wound with a gloved hand. When the pressure is being applied directly over the wound region with a gauze pad, the time should not be wasted in searching for the dressing materials. Elevate the extremity above the level of the heart. The extremity that is being affected should be elevated above the heart region with this as a method to reduce the bleeding. If the wound continues to bleed, do not remove the dressing. So, if the wound is continuously bleeding still, the dressing is not to be removed. Bandage the dressing in place. Now, when the dressing is being done, the bandages of the dressing is there. The purpose of doing the bandaging is so as to exert some more pressure over the region. Apply additional dress over it. Now, when additional dressing is being applied over it, the sole purpose of that is so as to control the bleeding, or if the bleeding still occurs, it does not ooze out of the region. If the wound continues to bleed, apply pressure to the brachial artery pressure point to control the bleeding from the arm. Now, after doing all of the measures of applying a gauze pad, double bandaging it, if the bleeding still occurs, then the brachial artery has to be elevated so as that to control the bleeding from the upper extremity region. Press the femoral artery to control the bleeding from the leg. Now, the femoral artery has to be considered to be stopping the bleeding from the neck region. Pressure points. Now, previously we have discussed that the pressure points are playing an adequate role in preventing of the bleeding, that is the elevation of the pressure points. So, let us see what are the pressure points present within the body. If direct pressure or direct pressure with elevation fail to control external bleeding, the next method is the use of a pressure point. As you can see in the picture, the artery points are the temporal, the facial, the carotid, the brachial, the radial, the femoral, popliteal, posterior tibial artery and the dorsalis pedis artery. Now, because of the direct pressure or the elevation, there is not the bleeding is being stopped. Now, the pressure over the pressure points has to be given. In emergency medical care, there are 4 sites, 2 on each side, used as pressure points to control the profuse bleeding in extremities. So, when in the emergency scenarios, on the both sides, the pressure points are there. That are the 2 brachial arteries and the 2 femoral arteries. So, as such, overall, 4 pressure points are being present and they have to be pressed upon so as to reduce the bleeding. Brachial arteries for bleeding from the upper extremities and femoral arteries for bleeding from the lower extremities. So, as such, the brachial arteries has prevent the bleeding from the upper extremities and the femoral arteries prevent the bleeding from the lower extremities. Splinting. Bleeding associated with a musculoskeletal injury may be controlled by proper splinting of an injury. Now, when there is a bleeding occurring because of a musculoskeletal injury, and in this scenarios, because of this scenarios, the splinting can play an adequate role. Cold application. The cold minimizes swelling and reduces the bleeding by constricting the blood vessels. Never apply ice or cold packs directly to the skin. This may cause frostbite and further damage to the tissue. Always wrap the cold ice or cold pack in a cloth or towel before applying it to the skin. Do not leave it in place for longer than 20 minutes at a time. As you can see in the picture, over the bleeding side, the cold application is being provided. When the cold application is being provided, what needs to be considered is that it is not left in place over for more than 20 minutes. It is not kept directly over the skin region as it can cause the frostbite, and continuous observation has to be done over that skin region. Now, if not anything works, that is either the tourniquet or is the last resort, considering the splinting has not worked, the cold application has not worked, or either the elevation of the pressure points has not worked, then the tourniquet has to be done. That is, the tourniquet is the last resort. Now wrap the tourniquet around the bleeding arm or leg about 2 to 3 inches above the bleeding side. Be not sure to place the tourniquet onto a joint. Go above the joint if necessary. Pull the free end of the tourniquet to make it as tight as possible and secure the free end. Twist or wind the windlass until bleeding stops. Secure the windlass to keep the tourniquet tight. Note the time the tourniquet was applied. Now when the tourniquet is being applied, it has to be kept directly over the injured side. And it has to be tightened up in such a manner that no excessive bleeding can take place. Now twist or wind the windlass until the bleeding stops. The tourniquet has to be tightened until the bleeding stops. And not only that, the timing the tourniquet was applied has to be noted down so as to when the medical assistant checks it, it can be seen when the tourniquet was being tied. Internal bleeding. When discussing the internal bleeding is bleeding that occurs inside the body. The bleeding itself is not visible, escaping of the blood from the circulatory system. Now, in case of the external bleeding, the bleeding or the blood can actually be seen coming out of the body. Now, no such thing can be seen within the internal bleeding. So, the severity of the internal bleeding can be shown in such ways. There are several reasons. Damage to the internal organs and large blood vessels can result in loss of large quantity of blood in a short period of time. So, if there is a damage to an internal organ or a vital organ, there can be an internal bleeding occurring, and because of that, the blood loss that happens can be a very large amount. The blood loss cannot be seen. Severe internal blood loss may even occur from injuries to the extremities. The negative point for the internal bleeding is the blood loss cannot be visible. And since the blood loss is not visible, it cannot be seen, as so the severity of the bleeding cannot be assessed as adequately as the severity of the external bleeding can be assessed. Now, what are the causes for the internal bleeding? Falls of the motor vehicle or the motorcycle crashes. In case if there is a motor crash accident or a road traffic accident, auto pedestrian collisions, another type of the road traffic accident, blast injuries, penetrating trauma also causes the internal injuries and bleeding. Gunshot wounds, stab wounds from a knife, ice pick, screwdriver or similar object impacted objects. So when there is a gunshot wound, there is a knife wound, there is a stabbing wound, in these scenarios, the bleeding occurs internally. Or in case of a road traffic accident, when the casualty has just fallen on the road, there is no any visible sign of external bleeding, but the internal vital organs are being affected and hence the bleeding is being done. Now, what are the signs of internal bleeding? Injuries to the surface of the body that may indicate underlying injuries. So now, when observing of the skin indicates that there are some changes happening beneath the skin, and because of these changes that are visible, it can be seen that the bleeding is present within the body. Bruising, swelling or pain over vital organs. As you can see in the picture, the bruising is there, the pain over the vital organs are there. Painful, swollen or deformed extremities. If the extremities are involved, they are painful, they are swollen, they are deformed. Bleeding from the mouth, rectum, vagina or the other body orifice or any of the body orifices, bleeding is being present. Signs of internal bleeding: a tender, rigid or distended abdomen. So if there is an abdomen, it appears to be tender or rigid. Vomiting, a coffee ground like substance or bright red vomiters indicating the presence of blood. Red blood, fresh or dark new blood, usually old. So if there is a vomiting present, if it is a dark in color, it is an old blood clot that is being seen. If it is a fresh pink color or a reddish color, it indicates a presence of the fresh blood within the vomiting. Vomiting basically indicates when the blood is being present in the vomiting. It basically indicates is that there is some damage to the upper gastrointestinal tract. Dark terrace stools or bright red stool in the blood indicating the presence damage to the lower gastrointestinal tract. Signs and symptoms of shock, late signs, altered mental status, pale, cool, clammy skin, nausea and vomiting, vital signs, changes. So if there is a mental status alteration, as we discussed priorly, the signs of the shock, which shows that a cool, clammy skin, a weak but a rapid pulse is there, nausea and vomiting. So these are all the signs of the internal bleeding. Patient or client care with internal bleeding. Prevention and treatment of shock. So now when the patient with an internal bleeding has been present, So what first aid treatment and what care is supposed to be given? So now prevention and treatment of the shock. As the patient might go into a state of shock, that is how the prevention is focusing on the shock. Patients with suspected internal bleeding must be considered serious and warrant immediate support to the hospital. So now in case internal bleeding is quite more dangerous as compared to the other bleedings, because here we don't have an idea of the amount of blood loss that is actually happening. And because of that, emergency medical care needs to be provided. CBA analysis, open the airway, adequate breathing and circulation, monitor vitals and the ABC often, establishment of an airway, checking for the ventilation, initiating the compressions, checking for the circulation, monitoring of the vitals. These are the few things that are being done in case of the internal bleeding is being present. Administer high concentration oxygen by non-rebreather mask. Provide prompt transport to an appropriate medical facility. So a prompt transport is also been given to an appropriate medical facility. The next emergency is asphyxia. Now the word asphyxia indicates that there is a difficulty in breathing. So now when the patient is having a difficulty in breathing, it indicates that something has happened, and because of the lack of adequate breathing facility, the patient's life can also be at a greater risk for the damage. So in these scenarios, what is to be done? So first and foremost, what are the causes of asphyxia? Strangulation by throat, attempted suicide, murder, etc. So when the patient has been attempted murder upon or is being attempting suicide, so the throat is being strangulated, and because of that, compression of the trachea has been done and asphyxiation occurs. Compression of the chest due to fall of heavy object or a crowd. The external chest compression is causing asphyxia. Injury to the lungs by some sharp object, stabbing, gunshot, etc. Because of a sharp object, a stabbing, gunshot wound, injury to the chest is happening. Obstruction of the air passage by falling of the tongue backward in an unconscious person, some foreign body spasm due to drowning, etc. So now because of some drowning, a foreign body spasm, the asphyxia has been occurring. As you can see in the picture, choking is present, aspiration of the vomiters, of the food, of the water, anything, drowning, inhalation of the poisonous gases, strangulation, suffocation and drug overdose. These are any of the causes because of which asphyxia can occur. Now, cause of the asphyxia, conditions affecting respiratory centers of brain, example, by taking sleeping pills, morphine barbiturates, etc. Now, in case the brain centers are being altered because of the taking of the medications, that also causes asphyxia. Conditions affecting the respiratory mechanisms, example, tetanus, head injury, paralysis, stroke. So, in those scenarios, also asphyxia can occur. Conditions affecting the amount of blood in the blood, amount of oxygen in the blood, deficiency of oxygen or smoke in room, high altitudes, deep diving, aeroplane, etc. So if there is an oxygen deficit within the blood, if it is a higher altitude because of a climbing of any hiking scenarios or aeroplane, so because of that also asphyxia can take place. Conditions preventing the use of oxygen in the body, example, carbon monoxide toxicity and cyanide toxicity. So the conditions which prevent the oxygen to enter within the body, any toxicities, can also cause the asphyxia. Now, what are the signs and symptoms? Whenever a patient, because of any of the causes, is going into a state of asphyxia, so what is happening? The symptoms that the patient shows are difficulty in breathing, cyanosis of face, lips, fingers and toenails because of lack of oxygens. The cyanosis can be seen within the face, lips, toenails and the fingernails, along with the visible difficulty in breathing, sounds or wheezing during breathing, nausea, swollen vessels of the neck, unconsciousness, fits may be caused by stoppage of breathing, fast or weak pulse, frothing from mouth or nostrils, sinus stroke respiration, spots before eyes or decreased vision. So the patient can also show unconsciousness, swelling. The patient can have the sinus stroke respirations. And these are the few of the things that patient exhibits when the patient is experiencing a state of asphyxia because of any of the causes. Now, what first aid has to be given on strangulation? So, save the life of the victim without waiting for the police, cut the rope around the neck, loosen the rope, give support and lay him down. Give artificial ventilation, shift immediately to the hospital. So now the rope that is being tried has to be removed. Do not wait for the police. Immediately the patient has to be transferred towards a medical facility. Now during asphyxia, so what is to be done in case the patient is actually experiencing the asphyxia? So clear the airway, mouth, nose and shift to fresh open air. So clearing of the airway has to be done. If the patient is conscious, check that the breathing is normal and give him the moral support. Now if the airway has been established and there is a visible breathing, so the moral support to the patient has to be given. In case of difficulty in breathing, give mouth-to-mouth ventilation, start CPR if required and shift the patient to the hospital immediately. Now not only the moral support is to be given, the checking, observing continuously of the breathing, checking and seeing if the CPR is needed, and if CPR is needed, CPR has to be started immediately, and not only that, the patient has to be shifted to an immediate medical facility. Now the another of the emergencies that is happening and requires first aid management is shock. Now when a state of shock is happening due to any of the conditions, mainly being an excessive loss of blood from the body, and because of that the vital organs are loosening its functions, so what is to be done? Shock is a life-threatening condition that develops when the body's blood pressure drops dangerously low. Because of any of the causes, if an individual's blood pressure is dropping dangerously low, thereby affecting the normal functioning of the body, it is said to be the body is going into a state of shock. Now what are the types of shock? So a mnemonic named chain can be remembered to understand the types of the shock. It can be cardiogenic, associated with the heart, hypovolemic, associated with the volume within the fluid volume within the body, anaphylactic because of any of the anaphylactic reactions, infectious, the sepsis happening, or the neurogenic, any damage to the nerves. So if because of any of the regions a body is entering a state of shock, it is called as a life-threatening situation. Now what are the causes? Great pain, a large burn, losing a lot of blood, severe illness, dehydration, severe allergic reaction and heart attack. If the patient is in a great deal of pain, if the patient is having an allergic reaction, if the patient is going into a state of unconsciousness, if the patient is dehydrated, if the patient is having heart attack, if the patient has been a burn victim, so in any of these scenarios, the patient can go into a state of shock. Now what are the shock signs seen within the patient? Pale, cold, damp skin, weak, rapid pulse, more than 100 per minute. So a weak pulse is present, but it is rapid. So it can be as rapid as 100 beats per minute. Cold sweat, severe thirsts, blood pressure drops dangerously low. Not only the patient is excessively thirsty, but the patient's blood pressure is now dropping dangerously low. Restlessness, mental confusion, weakness or loss of consciousness. The patient is having an altered sensorium, altered mental consciousness. So because of that, the patient can be seen visibly going into a state of shock. As you can see in the picture, dizziness, enlarged pupils, drowsiness, irritability, anxiety, fainting, fast pulse, shallow and rapid breathing, excessive sweating, nausea or vomiting, blue or grey fingernails or lips because of lack of adequate oxygen, and cold, pale or clammy skin. So these are the visible signs of shock. So the normal shock position that the patient has to be kept in is the most important treatment of shock is to maintain the blood flow to the body's vital organs, brain, heart and lungs. So whenever a patient is going into a state of shock, the entire focus has to be upon that the vital organs of the body, that is the brain, the heart, the lungs, are having adequate blood flow. So as you can see in the picture, the legs have to be elevated higher than the level of the head, and this is said to be a normal shock position. The first aid treatment, at first, the sign of shock or if there is a risk for shock. Have the person lie down with his feet a little higher than his head. If the shock is due to head injury, do not raise his feet. Make him sit propped up, half-sitting position against a pillow. Now, if you're observing that the casualty is showing the sign of shock or is actually in a state of shock, the legs have to be elevated higher than the head. But if the patient is having a head injury, then the elevation of the legs or the should not be done. In that case, the patient has to be kept into a half-sitting position. If the person feels cold, cover him with a blanket. If the patient is experiencing cold, a feeling of cold, then a blanket is to be given. If he is conscious, give him warm water or lukewarm drinks. If shock is due to injury, accident, stab wounds, etc., then do not give him any drink. He may need surgery, get medical help fast. Now, if the shock is because of any injury, a road traffic accident, a stab wound, so because of that, do not give anything to the patient to drink or to eat. because the patient might require surgery as quickly as possible and go and call for medical assistance. In case of pain, give him aspirin or other pain-killing medicine, but not one with sedative such as codeine. So the painkillers can be given but not a sedative. Keep calm and reassure the patient. Reassuring of the patient, maintaining the calmness of the patient, reducing the anxiety of the patient is very much essential. In case of allergic reaction, inject adrenaline if available, 0.5 ml in adults and 0.25 ml in children subcutaneously. If the blood pressure is very low, start IV fluid, intravenously fluid drugstores is available and seek help. So in case if it is because of an allergic reaction, adrenaline has to be given, or in adults and the children, the doses are different. That is adults 0.5 ml and in children 0.25 ml subcutaneously it has been given. If the blood pressure is being dropping still, then what is being given is the IV fluids have to be started for the patient. If the patient is still remaining unconscious, then if he has vomited, clear his mouth immediately. Be sure his head is tilted back low and to one side so that the vomit does not go into his lungs. The recovery position has been given to the patient so that the vomitus does not go back, the patient does not aspirate it, but it drains out of the body. Do not give him anything by mouth until he becomes conscious. The patient is not given anything orally until consciousness has been regained. If you or someone nearby knows how to give intravenous solution normal saline at a fast rate, seek medical help fast. The IV fluid has to be started immediately for the patient and medical assistance has to be arrived. Thank you.